Good evening, good evening. Welcome to another edition, episode number 2 of the Sporadic Flow podcast. Again, I am Ebony Kiana. We have
Hi.
Teresa and Zeline. So before we get into our episode this evening, I just wanted to refresh. If you guys have tuned into our first episode and you're here for another one, thank you for tuning in. If this is your first time, welcome. We're going to get real up close and personal. But I just wanted to refresh everybody and just read our mission and then our vision, just to get everybody up to speed so you guys know what we're wanting to accomplish with this podcast. So our mission is to empower individuals through accessibility and insightful discussions on health and wellness, led by seasoned nurses dedicated to bridging medical expertise with everyday insights. And we would love for you guys to join us as we explore practical strategies, inspiring stories, and expert advice to foster a healthier, more informed community. Together, we'll navigate the path to holistic well-being, one episode at a time. And then our vision is our podcast envisions a community where health and wellness are accessible to all, guided by expertise of a dedicated nurses, all three of us. And through engaging discussions, practical advice, and inspiring stories, we'll aim to empower individuals with the knowledge and tools needed for holistic well-being. Together, we'll aspire to foster a culture of proactive health management and personal empowerment, shaping a healthier and happier future. And so now Miss Teresa has something very special to read.
Awesome. Thanks, Eb. So just a little disclaimer before we get started with our podcast for today. Please note that the information provided in this podcast is for informational purposes only and is based on our professional experience and research. It is not intended to diagnose, treat, cure, or prevent any medical condition. Always seek the advice of your physician or other qualified healthcare providers with any questions that you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you heard on this podcast. So thank you, and we hope you enjoy tonight. I'm going to go ahead and pass it on over to Miss Z.
Hello, everyone. It's so good to be with my fellow co-hosts. We have a great show for y'all tonight. It's going to be on menopause, and all women luckily will go through these stages of menopause, which is basically the when your menses has ceased, and it's basically the lowering of your estrogen by your ovaries that's secreted, and over time, oh boy, all the symptoms and things that come with it. It just stops, your menses stop, which most women, that's the first part of the, where every woman kind of wants their menses to stop at some point. Nobody wants to keep having their menstrual cycle forever, right?
Yeah, no, ma'am.
And so, yeah, so around 40s, it just depends. I knew someone who had it earlier in their like 20s. So, it just depends on each individual, but it normally starts around your 40s, and there's 3 stages, and we're going to discuss those now. Starting with perimenopause.
I think I'm going through that a little bit.
I know I'm going through that.
Really?
I'm 47, so.
Right. Yeah, I'm right behind you. I'm 46. Yeah.
Yeah.
Like, I have not got into this yet, so I'm excited to learn about it though, so I know what to expect here in the near future.
So how old are you, Teresa? I've never asked.
I'm 38.
Okay. I knew. Okay. All right.
Or if I am going through perimenopause, I haven't noticed. So.
Well, once we go over these symptoms, you're gonna have your checklist.
Oh gosh.
Yes, no, yes, but yeah.
Well, let's jump right into the symptoms of perimenopause. What you got over there? I know we all know hot flashes.
Yes. And so for the research that I did, I was looking online. Like I said, I haven't got to this glorious stage yet. So I am going by what medical research says, and they say typically it does start about 8 to 10 years before you go into menopause. So what happens during your perimenopause period is your ovaries actually gradually produce less estrogen, and you may have or experience symptoms like irregular periods, hot flashes, mood swings. Um, and then also it says that if menopause occurs before the age of 45, it's considered to be early menopause, and it happens at 40 or younger. It's termed premature menopause. And I do know, like Z said, there are some cases, unfortunately, people have gone into menopause at 20 or in their early 20s, and it's not normal, but it does happen, unfortunately.
Yeah.
Yep. And one thing I want to say, when I was doing my research, I love the Cleveland Clinic. Even at work, it's one of my best go-tos before I talk to a patient regarding whatever it is the doctor needs me to educate the patient on. And with the ovaries, like Z mentioned, there's two main hormones that are needed for fertility, and it's the estrogen and the progesterone. So I just wanted to make sure that the ladies know that those are the two hormones that start to decrease, and that's an age-related change, something that we can't control because unfortunately it's a part of our fertility stage from puberty up until postmenopause. And we're getting to the point that where we're not going to be able to have children anymore. And then we have all of these delicious little symptoms, the hot flashes, mood swings. I know me, insomnia. There's some nights, probably since 2021, I've noticed that's probably like the last time I had a good night's sleep. And so it's up and down, and you're hot, you're cold, covers come off, covers come on. I'm all sweaty between my thighs, things like that. But then I'll have times where nothing. And my period is like clockwork still. So I know with perimenopause, once your periods start slowing down, becoming irregular, either longer than normal, shorter than normal, or you skip a month, make sure that you're not pregnant, because you can still get pregnant during this time as long as you have those fallopian tubes. But those are usually the first things that start to signal that your body is starting to go through the change.
I think that's the scariest part for me, because you sitting here thinking like, oh, I didn't went through menopause, I'm good, and bam, we have a baby.
Oh, right.
That is
And
so
I'll tell you,
scary.
like out of all of these symptoms, the one that I did not like was the vaginal dryness and soreness.
Girl, we don't need none of that.
That is, yeah. And then painful sex too. So luckily over-the-counter drugs, as long as you check with your doctor, make sure you don't have any allergies, make sure that it's all right for you to use these over-the-counter medications. You can KY jelly. There's also herbal supplements that you can take orally to help produce those extra juices, but just do this safe. I'm not looking forward to that. So hopefully I'm not going through perimenopause.
I mean, like you said, just to piggyback off what you said, it's not something, it's not a disorder, it's not a disease, it's not either, it's just naturally occurring. So this is something that females are going to have to go through. And well,
right.
I'm still stuck on the vaginal dryness. That just bothers me because it can lead to like tears and infections and
Yeah. And then so the
beating up the vaginal wall, so all that stuff.
I'm like, we're just going from one hot mess to another.
No, you didn't mention the vaginal wall, Celine.
But just the mood swings. I mean, you wonder why some people act a certain way around women, act a certain way. I never said, oh, she had mood swings because of menstrual cycle. You just be like, oh, she different.
It's that time of the month. She must be on her period.
Right.
That's the first thing that popped in my mind, to be honest.
Yeah.
It's unfortunately,
And it's so weird, like how hormones affect people so differently, because I don't know about y'all. And you know what? I am noticing this is changing as I'm getting older. So maybe this is part of like my womanhood changing. But normally my week of my period, which normally only lasts for about 2 days, and it's just spotting, it's not like a full on but normally that week I have the most energy. I'm the happiest out of the month. Like Yeah, my husband would be like, that is the best time of the month for me. Like you're like the happiest, most fun person. You have
Oh,
energy. And as I'm getting older, I do notice that is changing. I'm not like I feel like more sluggish now.
Mhm.
But in the past, like when I was younger, that was like my best week out of the month. It's weird. I don't know.
Mm. Hmm. I can't say
interesting.
either of those things being energetic or more sleepy. I know one thing, besides cramping and like your boobs swelling, being sore, things like that, those normal symptoms to let me know it's coming. And one thing that I do love is being around women, how our bodies sync together. Because now my
Mhm.
daughter is back
It
home,
does.
and the same thing, like when she's about to come on, then I know I check my Flow app and it's spot on. So I like how our bodies still become in sync, and you end up either piggybacking right behind each other right at the same time. So I think that's pretty cool. Guys don't have that. So
I
then,
don't
so we
know.
got the
I'm like,
perimenopause, and that leads us right into menopause.
Oh boy.
And so with menopause, you're officially going through that once you've had at least a year of no periods. Then you can officially say that you're going through menopause, the final menstrual period. And once that first year is done, you've already had the hot flashes, vaginal dryness, the sleeping problems. And I'll tell you, I remember with my mother, she had hot flashes for years,
Mm.
even though she hadn't had a period still. And when she'd have her hot flash, I remember even in the wintertime, my mom did security at nighttime. She was working for a Firestone warehouse. She'll go outside and she'll be hugging a metal pole. She had something cold. So that's how I knew if I pulled up to come visit her at her job and I see she's hugging a pole, like, oh, mommy's having a hot flash. And I don't think those stopped, because she still was getting hot flashes. So I know that. I'm pretty sure that's uncomfortable.
Yeah.
Yeah. So 1 year, keep that in mind for myself. 1 year solid, no periods. Officially, you're going through menopause.
I've had a hot flash by taking a medication before I took, well, it's over the counter niacin, and it gives you that like feeling from your chest all the way up, like like even though I'm black, but I feel like my face is red, and it's like you just get that hot sensation, and it can last for a few seconds to several
Mhm.
minutes. So
Mhm.
um,
Yep,
you
off
see
and
people
on.
fanning, people
Hmm.
fanning, and
Do you sweat? Do you get glistening? I know I haven't gotten that bad.
no.
see, I've
No.
had hot flashes for years just because I have asthma
Uh,
and I used to have to take really high doses of steroids, and that's a side effect of it. So I've had them for years. That's why I'm like, I don't know if
Mm,
it's hard to,
wow. Yeah.
mm.
displace if it's from that or like from the long-term use. Like I had the whole Cushing syndrome. Yeah. It was
Are you serious?
yeah, I had the big old cookie face.
Right,
Oh.
yeah. Yeah, we learned it as the moon face, a pie face. Aw.
Yeah.
Well, you don't have that anymore.
No, I
Was that a
don't.
long time ago?
Yeah, it's been a while back.
Really? Okay.
Yeah, but I'm like steroids, I feel like cause all the same symptoms kind of like as
Mhm.
menopause because
Yeah.
I
That's
had the
what-
night sweats, I had the hot flashes, I had mood swings. I would like blow up on people. Like I would literally blow up on people and within the next 2 seconds bawl crying because I was like I hurt their feelings. And it's like,
Oh,
yeah.
wow.
So
Mm.
I guess people who have been around me at that time know what I will be like in
Wow. Wow, wow, wow.
Yeah.
All right. And then, so I guess if anyone's wondering if there's any tests for menopause, there's hormonal tests that your doctor, they can draw just a little sample of blood and they can check your follicle stimulating hormone, and what's the other one, the luteinizing
Mhm.
hormone, and with checking estrogen and progesterone and all of that stuff, and then treat you from there.
Hmm.
Okay.
And I guess like
And
anybody seen anything about lifestyle changes?
Yes, I do see that there was some things like as far as how to treat the symptoms. It does say one of the things that you can do is lifestyle changes, like a healthy diet and regular exercise program will help to manage your symptoms and boost your health. Um, and then also unhealthy habits like smoking, drinking too much alcohol.
Mhm.
Um, those will also, you want to help have a healthier lifestyle by avoiding those. And it says avoid triggers like caffeine and spicy foods.
Yeah.
That's
Yeah.
not gonna work here in Texas. 'Cause they love spicy foods.
And then also too, Ms. Z, it says if you stay sexually active, that making healthy lifestyle changes may help preserve your vaginal lining. So since you're
Here you go.
since you're
Right,
worried
this is
about
where
those vaginal
we could
walls,
push the bell like ding 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 ding.
That's
That's
cool.
good. That's
you want to
I
funny.
do
keep those
like spicy
vaginal
food.
walls
I
just
don't know.
intact, guys.
Oh my gosh. Oh my gosh. Spicy food is my thing. I love spicy
Mine's
food.
too.
Really?
Yes.
You like
Yeah.
spicy foods, Teresa?
Yes.
Really? Yeah. See, not me.
It's the way I was raised. So like
Yeah.
when stuff is not spicy, I'm just like, this is so bland.
Really?
Yeah.
My nose start running. I start sweating. Yeah.
Yeah.
Yeah, I
And I
have a
like
sensitive
spicy, like
mouth.
I need spicy, like flavor spicy. Like my husband will have spicy with no flavor, but like he just wants the kick. And I'm like, no, I need like the flavor with it. Like
Flavor too.
Yes.
that's spicy. Like I love Thai food because of that. Like I love that.
Oh yeah. Yeah. You're a spice. You're a spice. You go that hot, Z?
Yes.
Yeah.
Thai?
I go that
Yeah.
hot. Yeah.
Mm.
So me and Z's vaginal walls may not be all that great.
That's all right. I'll take one for the team for you guys. That is
You like to
that
keep
is
it spicy.
funny.
Yes.
Ask
Mm,
my gynecologist,
mm,
can you check my vaginal walls? Because I've been eating a
right.
lot of spicy food
For
lately.
real. Right.
How
Educate
do they
yourself. The
compare
more
to
you know.
last year?
That's right.
Mm, that's funny. That is
That's funny.
funny. And you
And then
know,
also too, for your symptoms, you can get prescription medications from your doctors that you can help with some of the symptoms. And then there's also hormone therapy. I know they do like the is it the testosterone or they do hormones like that where they do that little slit in your butt? Y'all know what I'm talking about?
oh, the little pellets
Yeah.
you talking about? Yeah, the testosterone pellets.
Yeah. So that may be
Yeah.
helpful for some people. That's an option that
Mm.
could help.
Sometimes I wonder if I should get that. I've one of my nursing colleagues, I go to her I guess we can do shout outs and endorse things because she has the IV Drip Lounge, 1020 Navarro Street here in San Antonio, Texas, right on the Riverwalk. It is Riverwalk, right? Yeah. Because I get Riverwalk and Riverscape in Dayton, Ohio
That's
confused.
here in Dayton.
Riverwalk.
Mm-hmm.
Yeah. And we've talked about that. And she's had some horrible experiences telling me about the things that can happen where your body rejects it, pushes it out, or you get an infection. So, um, I guess
Yeah.
risks, benefits, things like that. And I'm sure it probably doesn't happen. And to be honest, I didn't even look into that. I was going to take a job where I was working at a health and wellness clinic, and that was one of the things that they did. They did the testosterone pellets, the quick procedure for that. But now I'm thinking back, I wish I would have, because that's probably, I know there's a lot of areas in nursing that I have not explored, but now that we're talking about this, I think that would have been pretty nice to have at least that experience to see the setup and assist the doctor with doing that, or the nurse practitioner or whatever.
I have a
So,
coworker who does it, I guess you would say electively,
mhm.
but she does it for fitness reasons and she did it to stop her cycle. So
Mm,
I want to say she's 45. I want to say 45.
really?
And so she doesn't have periods anymore, but she was saying that she's thinking about stopping doing them.
Mhm.
And then I was asking, we were actually just talking about this today. I was like, do you think your periods will come back? And she was like, I don't think so at this point, but
Hmm.
yeah.
Wow. A lot of options, a lot of options out there.
Yeah.
And then if a lady or someone in the audience is thinking, I don't want to do prescription. The type of person where I like holistic. There are non-traditional options as well. So always make sure you talk to your doctor before you try anything, but we're looking to educate and empower. So maybe we've discussed something someone, that's listening to this podcast has not thought about, and you want more information, play this back, take down some notes, do your research, and then take it to your doctor and discuss and see what the best option is. But there's acupuncture, meditation, relaxation techniques as well. And they do have herbal and natural remedies, but I didn't delve into that because, making sure that we don't give too much information, but someone can always schedule an appointment with their doctor and go over that information. But I want to try acupuncture just to see if it hurts.
I've never done acupuncture.
I want to see if it hurts.
I wouldn't think it's too bad. I would just say sticks.
Yeah, I'll let you guys know because I'm gonna do it because I know they use acupuncture for a lot of things, even relieving stress and certain parts of your body and things like that. I think that would be something that would help during like before your period come. Or just,
I don't know. I'm trying.
Yeah.
Oh, sorry. Go for it.
No, that was it.
Okay. No, I was gonna say, okay, I've never done acupuncture, but I have done dry needling, and that is deeper than acupuncture. And so I would think it would work.
Really?
Yes. One time I slept wrong and something was off in my back, like my shoulder blade. And one of my physical therapists at work, he actually did it at work for me because he was like, he took classes to get certified for it. And he was like, do you want to try it? So I was like, you know what? Let's go for it. He literally inserted a needle, it was a small, like a 24 gauge needle. I am directly into the muscle and hit that muscle. It made it start, like, I was like twitching on that muscle because like it activates it because you're hitting like literally that actual muscle that is giving you problems. It made it like I was having uncontrollable twitches. He did some little maneuvers I couldn't see because he was like behind me. And when he pulled the needle out, it looked like it had a stroke. Like that side was so relaxed. It was crazy. And that was just with one IM like prick. So I'm like, I feel like if it was that effective, just like with one, like it could help.
Interesting.
I know. I was skeptical at first, and it was weird. He was like, that's how he knew when he hit the spot is because I started like twitching. And he was like, I hit the muscle that's like giving you the problems. And sure enough, as soon as by the time he finished, my shoulder was just like limp because it was so relaxed.
Any problems since? Has it happened again? No?
Okay. No. You know how, I don't know, have you ever just slept wrong and it's like you kind of get like that crick, but it's like that whole area is like, so it wasn't like a injury or anything. It was just a stiff muscle that I couldn't get to relax for a few days. So he was like, you want to try this? And I was like, sure. So
man, that's another benefit of working in the medical field. You get things done for free.
But also use your judgment. Don't let somebody just snap your head off.
Right.
Yes. Right. Yeah. I remember, and this is off the topic of menopause, but I was in a car accident, December of 2006. I was a passenger in a head-on car accident, and my knees got crushed under the dashboard. And a part of my physical therapy was to go see a chiropractor. And that's the only one time I've ever done that. And I did not like that. You know how some people will crack their neck? I'm not the type of person to do that. You said that's you? You do that? Yeah, I'll crack my knuckles. That's about, or my toes, but that's about it. As far as like doing that, But the chiropractor laid me down and he was at my head, and the way he held my neck and told me to relax, and he cracked my neck, and I didn't like it. I didn't like it, and I didn't go back. Yeah. The tens, using that machine to stimulate your nerves and stuff, that I can handle, but I just don't like the cracking of the neck. Yeah.
And to
So
me,
having a
it's
crook
such
in
a
my neck is
relief.
just gonna have to relax out by itself. Mm-mm.
I was like, to me, it's such a relief. I like the feeling of it.
Really? Mm-mm.
Y'all
Yeah.
tried all kinds of stuff.
Really?
Yeah, I've not tried TENS unit, dry needling. Y'all tried it.
Hey,
Mm.
I've only
I
done the
dare
dry
you
needling
over
with that
there.
one and only time. It was a free service, and I was like, you know what? You're certified. I'll let you do it.
Yeah,
Mhm.
yeah.
Be his guinea pig. Well, that's good.
Mhm.
At least he know his certification worked, and
Mhm.
what he was taught, he was able to do accurately. At least in your case. So that
Yeah.
was good. So
Yeah.
yeah.
And there are definitely two supplements that you can take. Like I know there's supplements you can take for hot flashes. I know I try to go the natural route first before I know it's weird. I'm a nurse in the medical field, but I don't like taking prescription medication.
Mm-hmm.
So I'm like, if I can find something that's natural that will take care of that problem, I try. I know y'all do y'all's moss stuff. Like I am all for that. So
Mm-hmm. Love it.
So yeah, there are supplements that you can take that are over the counter that will help with your symptoms. But
Mhm.
like we said, make for sure to check with your doctor first because supplements, if you're on a lot of medications, can interact with your medications and cause a whole lot of damage too. So luckily I don't take a lot of prescriptions, so that's not an issue. But taking supplements can definitely have some bad side effects if you're taking them and your doctor is not aware they can interact with
Mhm.
other
That's
medications. So
right. Right. Have to be safe. Yeah,
awesome.
absolutely. That was a good point to bring out because I started looking earlier today, and when I started seeing the list of like herbal supplements, and I seen black cohosh, I guess that's how you pronounce it.
Mm-hmm.
That's one big one that interacts with a lot of medications negatively. So I was like, you know what, we're not about to get that deep. We're not OB-GYNs. We're
Right.
not nurse practitioners, physician's assistants. So we're not going to get that deep all into it because they go into the mental makeup and how it affects your brain and brain fog, and then all through that with the medications and over-the-counter herbal supplements and things like that. And I'm like, that's a rabbit hole I didn't even want to go down. But I think that we've done pretty good with just the information and the discussion that we've had thus far. If I was a woman that wasn't sure if I was going through it, or if I was going through menopause or postmenopausal, I would appreciate the information. Now, there's some women that have had this triggered because of a disease process or a surgery, a illness, intense stress, things like that. And, or they have like problems with their ovaries or fibroids and things like that. And, they might have to have, a hysterectomy because they have real heavy periods and things like that.
Yeah.
Then that's a whole completely, different thing. The most important thing is having your gynecologist on board and see what's going on. I know, especially like when you're getting ready to approach that age of perimenopause, it's genetic. And with me, I could remember like asking my sister, my cousins, my aunts, even my mom at the time, do you remember how old you were, when you started going through the change? My sister had a hysterectomy in her 30s. So she was like, she was not a good one to ask. But a couple of my older cousins, one cousin told me she was 51. So I'm like, okay, I'm 46 and my period comes like clockwork. So we'll see what happens. I still have a few years of dealing with pads and things like that. And I will tell you, I love going, especially like during COVID when I worked at CVS, being in the store when you don't have any patients, or if it's during your lunch break, having that CVS card, I walk up and down the aisles, me and my nurse practitioner that I was working with, and we'd go shopping. But I love looking down the feminine aisle just to see what they have for us as far as feminine deodorant sprays and oils and I love the little hypoallergenic feminine wipes. I can't think of, I think it's called Honey Pot. I would get that
It's honey
because
something, yeah.
I think it might be Honey Pot,
I
but
know it has honey, yeah.
right. So we're having a discussion. So whenever I have a bowel movement, regardless to where I am, I have to wash up afterwards. So that's why I love those wipes. And they have diapers now for your period that you wear
Oh, like to sleep in those?
to during the day, boo. You don't even have to sleep. You can sleep in them, but they're like briefs. Yes, briefs. Yes. That
No, I believe you, but I don't
you
want
don't
that.
need, and they have bikini underwear. And so based off of whether your period is light, medium, heavy, the flow and all of that. So I'm gonna try because I want to see if it really works, but do it when I'm gonna be at home.
I don't
But
want to sit in that all
I
day.
was just right. I don't like to feel it come out. So
Well, I can even with the yeah.
Don't do it, Teresa.
we're all adults. We're
No, I
grown.
just don't want to. I don't
Say
know.
it. Come on, girl. Get
No,
get
the fact of sitting on a pad like grosses me out, like because you're just
really?
like sitting on moisture.
feel it moving around. But yes, I was just surprised that they've got these, and some of them, I think the ones that I saw were cloth, but now they actually have the ones that's like the silhouettes for like the older women, but they're for your period and they're disposable. You just throw them. Yeah. So yeah, I don't want to make anybody uncomfortable, but I do have family members that wear those and have tried to talk me into it. And so before I'd be like, I'm not about to wear no adult diaper, but they're made so thin where you can't even see it under your clothes. You know what I mean? But it's like you're wearing an adult diaper and it's for your period.
Okay, so has anybody? I don't know if this is too personal. If I'm being too personal, then let me know. Has anybody tried like the cups or the disc or?
I have not, but I did have a coworker of mine tell me of the Diva cups.
Yeah,
Yeah.
that's
First
what
of
I'm.
all, and I know I'll just say first disclaimer, if there's any men on here, which I'm pretty sure there's not, because if there's any men that's listening, they probably said menopause, women, hormones, they don't need to hear it. So they're off. But just in case, because men, you have daughters, you have wives, so it's good, sisters, so it's good for you to be in the know. So, you'll be able to assist, or if you're going to the store on a run for your wife or your daughter, you'll know the variety. I bleed too heavy for a Diva cup. To me, that just does not seem comfortable, and it just does not.
Well, supposedly you're not supposed to feel it.
I'm not trying to stick my
Right,
fingers up
not.
in my vagina. I'm sorry. I'm not trying to stick my fingers in my vagina to pull out no cup and getting blood under my. It's just, to me, it's just, I don't know.
See, I don't know.
You
See, my
don't
periods are
really.
super. Oh, go for it.
Go ahead,
Z.
Teresa.
Oh no, I was gonna say my periods in general are pretty light. Every once in a while. Oh, you know what? It was one time period. I was like, you know what? I'm gonna do a cleanse. I'm gonna stay off of my birth control. I had like a real period and I was like in the restroom and I was texting my best friend, like, oh my God, I'm dying. There was blood everywhere. So then, yeah, in that situation, yeah. I was like, that was like a reality check. I was like, I don't know how women do this every single month. Like, it won't stop. Like,
The joys of womanhood.
I know. I was
What
like,
you
yeah,
think, Miss Z?
birth
She's
control
sitting
for
down
me
there.
because that was not like.
She just sitting there like she brewing and stewing.
Man, I've tried the Diva cup, and
Okay, you have?
I have tried the Diva cup before because I'm like, I don't like tampons because for me, I just need everything to come on out. And so I use pads, but I was like, when the Diva cup came out, I was like, well, let me go on and try it. Let me see what's good. And I was like, you to be like, I'm not, it's going to be everywhere. I did try it, but you don't bleed that much. And so, like, I think it's like, what is it, like 30 cc's or something like that. It's not that much. And so I was like, oh, I'm gonna fill this up because I'm like, you Eb, it's gonna get to the top and
Yeah,
flow
that's
over. But it didn't. It did not. And I changed it in the shower. So I didn't have a problem, you know.
See,
I'm
and
a
that was
pretty
my
graphic,
thing.
but I'm like, oh, that's what it looked like. And oh, you just like, I'm just like in awe. I didn't have a bad experience, but I
Could
didn't
you
like
feel
it.
it like inside of you? Like
Yeah. Oh,
you
you mean
could?
like in me? Did I feel it?
Yeah.
No. Mm-mm. Similar to a tampon. I thought, moving different ways would swish it all around and stuff, but no.
Mhm.
Yeah.
No, not at
See,
all. I didn't have a
see,
bad.
Ebony, we need to try these Diva cups.
Let me tell you, she said she changed it in the shower. So was this after a work day or you was at home and it was like,
I work from
outside
home.
of work? Oh,
Yeah.
that's right. I keep forgetting. I keep forgetting. Is it can you flush it down the toilet or you have to pitch it?
No,
No, you
it's
wash
not
it.
flushable. This thing is
You
like,
reuse it?
Yes,
yeah.
ma'am. It's like a
I mean,
little,
you could buy a whole bunch of them, but like that's not the point of it.
right.
I'd rather have the panties. I'm sorry. I'm not.
I'm not wearing no panties, no whole diaper around the house.
I'm like, I don't need to embrace like what's gonna be coming in the future. Like, I ain't trying to get there sooner than like.
Ain't nothing to
I'll
Right.
it.
wait till
I
I'm
have my
like
time.
incontinent and need a diaper, then I'll wear a diaper.
Wow, I couldn't imagine.
I
Because
don't know.
if you think you pulling it up and then it goes to the back, like it's gonna go.
No, and I'll just say because I've examined the one for heavy flows, and the coverage is just about from your pubis to your butt crack, and it's embedded in it, so it doesn't move. So you have the coverage, you know what I mean? So yeah, like there was nothing to Scotty Nick. There was nothing to move.
But am
Yeah,
I gonna like when
she-
you like if you said you have a heavy flow when you sit down, or is it gonna be like
But like I said, do you guys want some visual aids? I'll grab one and we can do show and tell. Yeah, because I'm to examine it. Yeah, I don't think it moves, but that
okay, so you're already like you've
might be
already
too
like
much.
you're dedicated, you're trying this out.
When I'm at home, so I don't have to worry about messing up my clothes or anything like that because
See, that's another thing too. Well, I guess
yeah,
I mean at work
like
you're not gonna be like on your side or like upside down or anything.
that's right. And you sit on your bottom and you know what happens, just like you said, when you sit down and that moist, bloody pad gets pressure, it's gonna come out on the side. So, but I would do it when I'm home and I can actually do a Q&A or, I can review and, my pros and cons. But yeah, because the one that I had checked out at the store, it was like in it, and I don't remember the name. I don't remember the name of it. Yeah, and the panties was just disposable. So now they have the briefs. So and the panties, I mean, they're cute. They have briefs. They have bikinis. Like, who's gonna have on a bikini
What is cute
style?
about bleeding in your baby?
You know what? I would say whoever thought of it, I appreciate the train of thought because you mess up your panties sometimes. And then that way you don't have to worry about it, at least for the ones that wear heavy ones. And I'll just say, full transparency, I wear a tampon and a pad, and tissue I fold up and put in my vagina lips because I don't like to feel nothing coming out. And when I go to
You
the
have to do all
bathroom,
three
take
of
the tissue.
those?
Yes, because when I bleed heavy, it's heavy. And so when you're at work, you're not always able to go to the bathroom
Yeah.
right away. You're conscious of your bottom and, making sure you're not bleeding through. But yeah, I'll wear a super pad. I'll have a super tampon and take tissue and fold it nice and neat in my lips, and she holds it. And I go on about my business because I don't want to feel nothing trickling out. And then, I go to the bathroom, pull everything out, wipe, put fresh in and go. So I appreciate those underwear in the fact of, because I have period panties that I only wear when it's that time, and then I have my cute panties that I wear the rest of the month. And it saves you from messing up your panties and having to soak them in peroxide and wash them in cold water and all of that stuff. So I haven't tried it, but I can appreciate the thought behind it. Man, I'm pretty sure it's for these young women, these 18, 20-ish,
I don't think young women are gonna go with that.
Really? I'm gonna tell you.
Z, what do you think?
My
not
daughter
for
tries them,
everybody,
so
right?
that's who educates me on how things go in her active lifestyle. So that's why I figured, it's the young ones. And when I was at the CVS on FM 78 here in San Antonio in Converse, a couple of the girls that worked there, that was like, oh yeah, you're trying this. Like, oh great, so what? And they didn't have a large variety, and this was back in 2020. They didn't have a large variety, but it was the younger girls that worked in the drugstore that used them. So this old vagina
Okay.
got some miles
I was-
on it. I might need the brief versus the little cute panties, or got a wider butt, you know what I mean? So
Could y'all imagine not having a cycle?
yes, I just hope that I would not be too moody, because now I've asked my husband and my daughter, like, am I moody? And they both said, of course Camry says yes, but Cedric was like, nah, and I'm like, yeah, can you tell? And he said no. And that's why I said I like to think I'm pretty chill. I'm not pissed off one minute and then I'm cool the next. It's like a slow low boil. But I think I would be the same. I would definitely opt out of having a hysterectomy unless there was something medically necessary. But I want to keep my uterus and my ovaries and go through it, make sure that I don't gain weight, because I know that's another thing that happens. We lose our bone mass and all it starts shrinking and brittle bones and all of that stuff. So I will make sure that I would be proactive as far as my calcium and my K2, which I have my supplements and stuff that I take now to help with my bones and my energy and stuff like that. But I think it would be pretty cool not to have a period, and it not be because you're pregnant or because you're on a birth control pill. It's just the natural part of life,
How about you,
I think it
Teresa?
would be, I said, I think it would be amazing. I'm just worried about the other stuff that comes with it. Like, is it gonna be, I'm just like,
Is that the other symptom
could we not get a break? Could we we go through 50 something years of having a period. Like, can we not have no period and no side effects? Like, it's like period stop and then you lose your mind. So
Yes.
I don't know.
I
And
think
then I'm
that-
like, is my vagina gonna be so dry that I wish I had a period to moisturize it a little bit?
right. That would be very hard to deal with, especially if you have a partner. You'd have to get, products and stuff to help along the way. It probably affects your, who you are as a person, because, you're losing a part of you and gain, like you said, all these symptoms. And it's like, oh my gosh, I'm sure it probably affects, people who have partners, and I mean, in that case, you definitely want to seek some professional help, mental health. But yeah, I don't know. A lot of the hormone replacement therapy causes also some like risk. You was mentioning, Ed, like bone loss. You can get coronary artery disease, stroke. So it's like hormone therapy, or try something natural like y'all saying, or deal with it. It's like it's a lot of difficult choices to make to manage.
Yeah. Z, are you and Ebony around the same age?
I'm 47.
Okay.
She's a little
We're on the
older
same
than
age.
me. I'll be 47 in October.
Okay.
When did you turn 47, Z?
This past January.
Oh, okay. Okay. Wow. Yeah.
Yeah.
So we're
So
close.
I'm like, it's kind of scary,
It
but
is.
unexpected.
It is.
And one thing that we did not talk about is like body changes too, as far as like hairs in places. And I could remember being on birth control a few times. I could remember after I had my first son, Daniel, because I was a teenage mom, and my mom didn't want me to get pregnant again doing the Depo-Provera, and that made me gain weight, and I had crazy headaches. And I can remember my grandmother did not like it because it stopped my periods. And she would always say that, and they call it your monthly. My grandmother never said period, it was your monthly. You're not supposed to stop your monthly. That's something that a woman is supposed to have to clean her body. But I blew up like a balloon and I had to stop taking it. But now I notice I get some chin hairs. And I used to say it was like, I remember telling my daughter it's because I love Chinese food. And it was my, Fu Manchu,
I was like, what does that have to do with Chinese
yeah,
food?
eating Chinese food so much, you get the random chin hairs and stuff, so that's what I would tell my daughter,
Okay.
like, I eat a lot of Chinese food.
Oh,
But
okay.
yeah, it's from the birth control. Like, I know, but then like, this is even crazy. I get a random hair right here on my ear that I have to pluck. Or like randomly my nose hairs, like my nose would be bothering me and then I could do like this and end up sneezing because I pull my hairs, and then I'll go in the bathroom, look in the mirror and get the tweezers. And yeah,
Oh,
so I
that's
have to
not
get
fun.
me a trimmer for my nose. But yeah, I'll get the tweezers and pull my
Yeah.
nose hairs just randomly. And I'm like, that's probably part of grooming, you know what I mean? Not looking like a werewolf. But yeah, I probably have like maybe 8 hairs now. And I'm like, I'm 46. And I'm like, it's 8 of them. And sometimes, like now, I need to go to the bathroom and I need to pull a hair. Like, and my aunt, she'll probably be mad. She has one under her chin. And when I go see her, and she'll be talking and I'll just see it just moving. And I'm like, just let me get the tweezers just one
No, you
time.
ain't supposed to do that. You ain't
You're
supposed
not?
to tweeze. No, you don't supposed to tweeze.
Why? I
I
tweeze
know. I
all
was
the
like, why? I
time.
tweeze mine's out.
Because it's like you don't know if you're pulling a hair next to it, and then you bring another hair and another hair. Not that I'm speaking from experience, just don't do that.
Right. Then when you just leave it willy
Don't do
nilly
that.
and just let it grow,
I
braid it,
mean, they
ponytail,
got,
what?
yeah, well, some people don't want lasers, some people don't want
Wax,
to like do the
wax it.
threading, I don't know, but
I was like, I
they,
tweeze. I didn't know we weren't supposed to.
Yeah,
you're
I
pulling the
tweeze.
lick a hair out of the, you're pulling it. You ain't
Let me
supposed to.
see. I
It
tweeze
leaves a
my
dark
chin and
spot,
my
don't it?
eyebrows.
Don't it leave
I've
a
had
spot when you pull, Teresa?
Oh,
You don't have no dark spots?
I've had chin hair since I was like in high school. I
I was gonna
remember.
say I had chin hair. Like I had one long hair on my neck when I was like 16. So I don't
and
know.
what you do with it?
Oh, I pluck it.
After you just told us we're not supposed to do that.
Well, that's why I'm telling you don't
I
pluck
was gonna
it.
say she gonna
I
pull it
knew
down her
that another
shirt
one
like,
would
here it
grow.
is.
Oh, girl, it's still here.
Right.
Okay. Okay.
Like, what you do with it if you ain't? Oh, yeah.
It's another one gonna come, but okay.
Yeah, but I do want to do the laser. I know now that they make things so, I don't know if it's because of COVID, a lot of things you can do at home. But I know they do have, I think one is called IGEA, and then there's another one that's called Rose something, I think, where you can do
That's several.
you can do it yourself at home. So maybe I'll get into that because waxing, I've gone to like get my eyebrows waxed, and they'll ask, do you want your mustache? Well, I don't have a mustache, but like I do have some whiskers you can do under, and I don't have any black marks or anything. But I'm like, you can go ahead and take care of that for me. But it would be nice to be able to just kill the follicles so I don't have
Yeah.
any hairs.
Mm.
Because at
So
this rate, by the time I'm 55, I'm gonna have a little goatee.
I was like, so I have to admit, I shave my whole face like every 3 weeks.
Do
The
you?
whole face?
Well, like from here down, yeah.
Really? Do you use that skin? I've seen on TikTok the skin, so you spray it and it shows up where your hair is.
I have not. I've never used that. I actually just get like a pack of blades, like from Marshalls or Ross, like the ones that you use for your eyebrows to edge
Yeah.
them.
Yep.
And I soap up my face, lather it up, and I literally do my whole
Really?
face. And
Yeah, they have that stuff now. I think it's called skin, like
I know what you're
SK.
talking about. I've seen it. I've just
Yeah.
never used it.
Yeah, and they use it and it shows up all of your hair and you use it to like dermaplane,
Mhm.
kill those deads. I want to get it just to see how much shows up on my face. I don't think I'm very hairy. Like
I
at
have
least not there.
I like I don't like the peach fuzz, and like so I just shave it all off.
Really? Yeah.
The mustaches, get the mustaches.
Mm-hmm.
Yeah,
Yeah,
I
you
do
looking
it
like Miss Pearly.
to try to keep it cute, but
We have to.
the life of a woman, huh?
That's right. A lot of things. Getting older, body changing.
Okay, when you said hair, it made me laugh because like I have one gray hair there.
Oh, I have tons of gray hair down
I
there.
have one, and when I noticed it, I like freaked out. I was like, "Mom!"
Did you?
I sent her a picture of it, and she's like, "What is
You
wrong
should have
with
sent her a
you?"
picture. That's
And
mother
it's just
daughter
that
love.
one, and I'm like, that one I haven't
Pluck it.
tweezed, but
Tweeze
maybe
it.
I should.
Look at Z. Oh, please don't.
Maybe I should because it bothers me.
Pluck
Like
it.
that for some
Can you
reason
get
that's
to
what
it?
makes me, huh?
Can you get to it easy?
Yeah.
Yeah, tweeze it.
It's just like
Get to
what
it.
one. I mean, like not that I want it to be all gray, but like that that was like a shocking moment for me.
Really? Yeah. You got any gray hairs? Zeline?
Well, I'll just say this. I was shocked too, Teresa, because another nurse I was working and she just was like, yeah, you get white. I was younger and she was like, you get white hair down there. And I was like, what? And I never thought about getting white hair down there. But because I don't really hear a lot of women talk about white hair down there. You hear
So do you have any?
older women talk about gray hair, or people talk about they don't talk about down there, and I'm like, what? White hair, girl? She's like your lips down there. They get like thinner and stuff, and I'm like, what? Girl, I did the research. I was like, oh my gosh, I can't believe that. Yes, white hair has appeared.
Oh Lord.
Okay. Yeah, it looks like I have on. Stop. You don't hear my dog, right? Okay.
Mm-mm.
All right. I'm glad because man, she's noisy. She probably wouldn't because she's about to be 70, so maybe she wanted to tell me about her gray hairs.
She's
She
like,
white,
"Child."
so she white, so you can't tell. This
Yeah.
is interesting.
I was shocked with that. Like I don't know. I look at my vagina like almost every night, and that one night when I looked, I was like, "Ooh, got a little dust
almost
in there,
every
girl."
night.
I do. Y'all don't look at y'all's vagina all the time?
Not almost every night, Teresa. No, ma'am. I can't say that I do. With a mirror?
That or my phone camera. I'm just like, let me check, see what she looks like.
Really?
Yeah.
It's amazing. Some women have never even looked down there. And I was like older. I was like in my 20s, really kind of when I first looked, because I was like, what? I don't even know what it looks like. Took a mirror, I was like, oh, okay.
Oh.
But it's amazing that some women have never looked. They don't even
Mhm.
know what's down there, and that's important. So
Yeah, one thing with us being nurses, I've had to teach a couple of female patients how to self-catheter, and so then that's when you get the mirror and make sure the door is closed and have them sit comfortably and prop their legs up and here, hold it, and
hold it open.
yeah, so your anatomy and where you pee from and where the babies come from is where you bleed from, and yeah, so
There are different holes. Just FYI, in case you didn't know, that there are different holes down there.
For sure.
Right. Yeah.
And being a nurse, like our anatomy, like I've cathed people and I could not find the urethra. Like for
And they say
females,
it's
like
supposed
we're
to
not
wink. Yeah,
we're not all the same on that
mm-mm.
aspect.
No.
Yeah.
We are definitely.
I've heard of the wink trick. I don't personally use the wink trick, but
I mean, if the anatomy is there, then yes, it works well. I could
Yeah.
remember having to have my CNA. I mean, she put on gloves too. She was dirty. I would, after you put on your sterile gloves,
Yeah.
I have one dirty hand and one clean hand. And I mean, we've had to literally grab, and she get down in there and grab the patient's
Yeah.
vagina and pull it up so that I could get to it, because yeah, it just wasn't where it was supposed to be. Like, you see the clit, but you don't see the urethra. And so, yeah, I had this one CNA, I mean, get down in there, damn near had a patient in reverse Trendelenburg, legs up in the air. But just to, heavier women, or their anatomy has prolapsed, and it was hard getting this Foley in this patient. We finally did, but I mean, I felt like my CNA was gonna rip her lips off. Seriously, but just how much she was, I mean, she was manhandling, and I got it in. But so I was sitting here like, man, God, there's no way I'd have been able to do this by myself. It was just too much flesh down
Sometimes you
there,
got to
too
get them
much
elbows in
tissue.
there, like.
Girl,
Yeah.
for real. I needed like a protractor or something. Man, just, yeah, we needed
Being
to
a nurse
measure.
and seeing all these things that y'all talking about is
Mhm.
amazing. As a nurse, you
Mhm.
just see so many different things, and
Yeah, like has
yeah,
to be
women
done. Has to be
anatomy.
done.
Mm-hmm.
Amazing. Amazing. So I think this was a very wholesome show. Give
Now
the
you know that you know a little bit more about us too.
right, but right, and about women's anatomy. And I'm pretty sure if there are any men that is tuning in, they probably thought like, oh, dag, that's what it was. Yeah. I mean, and if we're gonna talk about anatomies, I mean, we're not the same. Some looks like heads to a penis. I mean, some just big clits, little clits. So I mean, and being a nurse, you have to deal with all of it, and then you have to document, what you see, what you smell. You know what I mean? So
Yeah.
yeah.
Mm-hmm.
Perimenopause and
Mm-hmm.
postmenopause too.
Mm-hmm. Gray hairs is not not
Single
limited to
gray
the top of
hair
your
on the
head.
left vagina.
Mm-hmm. That's right. Yep. So
Mm-mm.
that's life. And then Z has some supplemental information. Didn't forget, because men. So I mean, this is probably mainly going to be for women, but the women out there who have boyfriends, significant others, you've got that common law marriage, or you are married and you guys have been together for a long time. It's not just women that go through the change, Miss Deline.
Yeah, I think we might have to do that on another show. I think we're running out of time.
Okay. Yep, we can
But
end it whatever, because I put it for 3.
it's called andropause, but andropause for males, and basically it's just lower testosterone every year. This pretty much Cleveland Clinic, everybody say it's like 1%. It drops every year for males around the age 30 to 40, up to 55. So we'll have to do a podcast on that for
Let
sure.
that be, yeah,
Yeah.
specifically for the men. So just so they'll know, that'll be coming up soon. We'll do a follow-up for a menopause.
I'm like, there could be so many episodes like on hormones in general, like that controls so much.
Yeah, the hypothalamus and the pituitary
Yes.
gland and all of that. Yeah, yeah, a lot of good stuff. So I just hope that we'll be able to reach many people, and I hope this podcast is informative, and I enjoyed tonight's episode just as much as I did last week's. And so I look forward to the discussions that we're going to have together. And so I
Very
thank you
much
guys
so.
for letting us into your homes, your cars, your office, wherever you guys are tuning in. We really, really appreciate it. And we would love feedback. We'd love for our audience to get on our website. Was it www.sporadicflowpodcast.com, and you can pre-register and send requests, ask questions. And then we have our Facebook page, we have our YouTube page as well. So
We're on
I was gonna
all the
say-
podcasts.
Yeah, I was gonna say, make for sure to go on there because we want it to be interactive. So like we want to address things that are like concerns or issues or that y'all have questions about too, not just us. So yeah, for sure.
yeah, right. And I hope we covered the information. Z, I know this was a special request, so I'm hoping that our discussion helped out our audience, you know, at least the young lady that requested this, so that hopefully we answered her questions. But if anybody else has any other input, any questions, comments, concerns, please don't hesitate to share with us. And we're going to keep everything respectable and polite.
Yeah, I was gonna say
Yeah.
this is a safe zone, so like we will answer your questions, and unless you want us to give you a shout out and mention your name, we're not gonna be over here like Z. So when you said you had that dry vagina, don't worry, we're not gonna call you out.
Right. That's the after hours conversation.
Right.
To let everybody know that, but yeah, that would be good. So yeah, ladies, I mean,
Awesome. So until next Wednesday when we see you again, we'll discuss. We'll be checking the Facebook group. We'll be checking the website, see if there's anything specifically that you want us to address. And we are excited to see y'all next week.
Bye.
that's right. Everybody stay safe.